Welcome to the Deep Dive. Today we're exploring ashwagandha. It's an evergreen shrub, with the deep roots in traditional medicine across Asia and Africa.
Hmm.
Its Sanskrit name is pretty evocative, smell of the horse. Speaks to its reputation for boosting vitality.
Right. You also hear it called Indian ginseng sometimes, or winter cherry.
Though, important note there, it's not the same plant as the ornamental Physalis alcakengi, which people also call winter cherry. Totally different thing.
Good point. And our mission for this deep dive is pretty clear. We want to pull out the most compelling potential benefits of ashwagandha, looking at the research that's out there.
Yeah, give you, the listeners, some valuable insights into this, fascinating plant.
Exactly. We've looked at a bunch of sources, studies, big reviews, expert takes, trying to get a really well-rounded picture for you.
Okay, let's dive in then. Ashwagandha often gets called an adaptogen. What does that actually, mean for our bodies?
That's fundamental. So adaptogens are thought to basically help our bodies become more resilient, facing different kinds of stress. Research suggests they help us navigate stress, maybe improve our tolerance, help us cope better, and ultimately return to a sort of baseline equilibrium.
Right.
And what's really interesting is how ashwagandha might do this. Studies suggest it can influence these key internal stress signals, things like heat shock proteins.
Which help protect cells,
Right.
right.
Exactly. And also JNK1, which is a pathway involved in the body's stress response.
So it's like it helps our internal systems buffer the hit from stress a bit better.
Precisely, yeah. And research points towards ashwagandha potentially modulating the activity of the hypothalamic pituitary adrenal axis, the HPA axis.
Okay, the HPA axis, that's like the main stress control center.
You got it. It's your body's central command for stress. And the evidence suggests ashwagandha might help just gently dial that back when it gets stuck in overdrive.
Hmm.
For instance, there was one study where people took either 250 or 600 milligrams of ashwagandha extract for 8 weeks. And they actually reported, noticeable reductions in how stressed they felt. And they also had lower levels of the stress hormone cortisol compared to the placebo group.
Wow, okay. So that suggests a real physiological effect. It's like a natural buffer against, daily pressures.
That seems to be the idea. It suggests a direct impact.
That's pretty significant.
Yeah.
So it's not just feeling less stressed, but maybe measurable biological changes too. I also saw stuff about anxiety.
Correct, yeah. Another study, this one had 60 people. They took 240 milligrams daily for 60 days. And they found significant drops in anxiety levels compared to the placebo. And you think about it, managing both stress and anxiety, well, that can have really positive ripple effects on just overall well-being.
Absolutely. And some perspectives we reviewed highlighted it as maybe a top herb for nervousness, mentioning positive effects on both the sympathetic, the fight or flight, and the parasympathetic, the rest and digest systems, and again, lowering cortisol and adrenaline.
Exactly. That perspective really lines up with the scientific understanding of its adaptogenic side, its effect on stress hormones, which, naturally leads us to another potential benefit area, sleep.
Makes total sense. Less stress often means better sleep, right?
Mhm.
What's the research saying about ashwagandha and sleep?
Well, the research suggests it does hold promise there for improving both overall sleep and sleep quality.
Okay.
There was one study with older adults aged 65 to 80. They took 600 milligrams daily for 12 weeks.
Right.
And they reported significant improvements in their sleep quality. Plus, they felt more mentally alert when they woke up, which is, a great outcome, feeling refreshed.
Definitely valuable.
And then a big review looking at multiple studies indicated ashwagandha has a, small but statistically significant positive effect on overall sleep quality.
Interesting.
Yeah, and this review also noted reduced anxiety and increased alertness, especially, it seemed, in people who actually had insomnia and were taking over 600 milligrams daily for 8 weeks or more.
And again, some V's connect that improve sleep directly back to lowering cortisol and adrenaline from stress.
That's a really consistent theme, yeah. Lowering those key stress hormones, it just seems to create a better internal environment for restful sleep.
Okay, so let's shift focus now to something maybe a bit surprising. Athletic performance.
Yeah, that's not the first thing I'd think of with a calming herb.
Right, but analyses of research actually suggest ashwagandha might help enhance physical performance, things like strength, and how efficiently the body uses oxygen during exercise.
Really?
Yeah, and the studies looked at a pretty wide range of doses, anywhere from about 120 milligrams up to 1,250 milligrams a day.
Whoa, that is a wide range. What does that tell us?
Well, it suggests researchers are still figuring out the sort of optimal dose for these specific benefits, but there was a meta-analysis that looked specifically at VO2 max.
Maximum oxygen consumption, that's a big marker for endurance fitness, right?
Exactly. And this analysis found that ashwagandha significantly improved VO2 max in both healthy adults and athletes. So, potentially boosting endurance.
That's what the research suggests, yeah, a potential outcome. And it might go beyond just endurance. There was another study with male participants doing resistance training.
Yeah.
They took 600 milligrams of ashwagandha daily alongside their training, and they showed greater gains in both muscle strength and size compared to the guys who didn't take it.
And we did see mentions of its traditional use for improving stamina and endurance too.
Precisely. So it paints this picture of a really multifaceted herb,
Yeah.
affecting not just mood and sleep, but potentially physical capabilities too. Okay, moving on, let's touch on mental health conditions.
Yeah, given how common mental health concerns are, this is a really important area to explore.
Research has definitely looked into it. One study showed that people with schizophrenia who took 1,000 milligrams of ashwagandha daily for 12 weeks actually had greater reductions in depression and anxiety compared to those on placebo.
That's quite notable,
Yeah.
suggesting it could be a potential add-on therapy.
Potentially, yes. There's also some preliminary research hinting at possible improvements in cognitive function for people with bipolar disorder.
Okay.
And a review of studies suggested ashwagandha might be helpful in managing symptoms of depression, anxiety, insomnia, and maybe other neurological issues. But, and this is important, that same review really stressed the need for more bigger, more rigorous research to really confirm these findings.
Right. So promising, but definitely still early days for some of those applications. More research needed. Okay, what about effects on, say, male hormones?
Yeah, several studies have looked at this. One found an 18% greater increase in DHEAS and about a 14.7% greater increase in testosterone.
In who?
This was in overweight, mildly fatigued males taking ashwagandha extract. And those are, statistically significant increases. Worth looking into more.
Those are definitely significant jumps in key hormones.
Absolutely. And another review backed this up, showing significant increases in sperm concentration, semen volume, and sperm motility in men who had low sperm counts to begin with. And even some improvements in guys with normal counts. So it suggests potential benefits for male fertility.
And some sources pointed specifically to its potential for improving male hormones, sex drive, sperm count, motility, all contributing to better fertility.
Exactly. The research seems pretty consistent in that direction. Okay, let's switch gears again. Blood sugar regulation.
Right, something a lot of people are focusing on these days.
Yeah, and a review looking at multiple studies, including trials with people who have diabetes, it indicated that ashwagandha treatment was linked to significant reductions in blood sugar, HbA1c, that long-term sugar measure, insulin levels, blood fats, and even markers of oxidative stress.
That's quite a list of positive effects on metabolic health markers.
It really is. Researchers think these effects might be partly due to compounds in ashwagandha, like with wafir-NA. It might help stimulate cells to take up glucose.
And some perspectives link this back to lowering cortisol again, maybe improving insulin resistance that way.
That's definitely a plausible mechanism, yeah. High cortisol can mess with blood sugar control. Another really big area that came up is inflammation reduction.
Ooh, interesting. Since so many chronic conditions have that inflammatory component.
Precisely. Ashwagandha has these bioactive compounds, including that with wafir-NA again, that have shown anti-inflammatory properties in studies.
Okay.
There was even one study in people with COVID-19 that showed lower levels of key inflammatory markers, CRP, IL-6, TNF-alpha, when they took an Ayurvedic medicine containing ashwagandha.
And we saw other mentions highlighting these anti-inflammatory abilities too.
Yes, it's definitely a recurring theme in the literature. Okay, lastly, let's talk brain function.
Always interested in that.
Okay.
Anything for focus, memory, cognitive health?
Well, a review of clinical studies gives us some preliminary evidence. It suggests improved cognitive function in certain groups, like older adults with mild cognitive impairment, and also people with schizophrenia.
What kind of improvements?
Things like executive function, attention, reaction time, just performance on cognitive tasks overall.
That sounds really encouraging for the, maintaining brain health as we age.
Definitely. And another study, this one in healthy adults, found that taking 600 milligrams daily for 8 weeks led to significant improvements in immediate and general memory,
Wow.
and also better attention and information processing speed. Researchers think maybe the antioxidant effects of compounds like with afrin A in the brain might be contributing to this.
And some views we saw mentioned it could lead to better brain function, maybe less brain fog, which lines up nicely.
Absolutely. And beyond these, quite well-researched areas, some perspectives also suggest other potential benefits, things like supporting thyroid function,
Okay.
though caution is definitely needed there if you have hyperthyroidism. Also, maybe regulating the immune system, possibly through that cortisol effect again. Maybe some relief from certain types of pain, like low back pain or muscle spasms, reducing fluid retention, and even increasing heat shock proteins, which we mentioned earlier, helping cells adapt to stress.
It certainly sounds like a very versatile botanical. But, okay, with any supplement, we absolutely have to talk safety, side effects, precautions.
Absolutely crucial, yes. So based on the research we have now, ashwagandha is generally considered possibly safe
Okay.
for most people when you use it short term, usually up to about 3 months. But the long-term safety, we just don't have a lot of data on that yet.
All right. And side effects.
Potential side effects seem mostly mild digestive stuff, usually, like stomach upset, maybe some diarrhea, vomiting. But in rare cases, more serious liver problems have been reported.
Okay, those potential liver issues are definitely something people need to hear.
Yes, definitely. Now, if you use it topically, like in a lotion, it seems possibly safe for up to 2 months, but there are some really important precautions.
Like what?
Well, it's considered likely unsafe during pregnancy. There's a potential risk of miscarriage, and best to avoid it during breastfeeding too, just because there isn't enough reliable safety info.
Okay. And what about people with existing health conditions?
Right. Caution is advised if you have an autoimmune disease, because ashwagandha might actually stimulate the immune system, which you wouldn't want.
Makes sense.
Also, use it cautiously or maybe avoid it if you have existing liver issues because of that potential risk we mentioned. And standard advice, stop taking it at least 2 weeks before any surgery because it might slow down the central nervous system.
Right.
And for thyroid disorders, again, caution or avoid because it could potentially increase thyroid hormone levels.
Okay. And interactions.
Yeah.
Lots of people are on other medications.
Very important point.
Yeah.
Yes, there are several potential moderate interactions to be aware of. It might make immunosuppressant drugs less effective. It could also increase the effects of sedatives like benzodiazepines or other CNS depressants. That could lead to too much sleepiness, maybe breathing problems.
Okay, serious stuff.
Yes. Taking it with thyroid hormone medication could cause too much thyroid hormone. Taking it with diabetes meds might lower blood sugar too much. With blood pressure meds, might drop blood pressure too low.
Wow.
There's also a concern it might increase the risk of liver damage if you take it with other drugs known to be hard on the liver. And some minor interactions with meds processed by the liver, possibly changing how they work.
And some sources specifically mentioned contraindications like sensitivity to nightshades, like tomatoes or peppers.
Yes, that came up.
Also, iron overload, hyperthyroidism, you mentioned, that pregnancy, obviously, due to lack of human studies, and enhancing effects of barbiturates and thyroid hormone.
Yes, those are all really important points to consider. So given all these potential issues, the quantitative dosage becomes really critical.
Right. What's a typical range used in the research?
Studies in adults have generally looked at doses up to about 1,000 milligrams daily, usually for up to 12 weeks.
Okay.
But, and this is key, it's absolutely crucial you talk with your doctor or another qualified healthcare provider first. Get personalized advice on dosage based on your own health situation.
Always the best, most responsible approach. And we should also definitely mention ashwagandha is a natural herbal supplement. Right. So it's not regulated by the FDA in the same way prescription drugs are.
That's a really crucial distinction, which leads us straight into our important health disclaimer. Everything we've talked about today, it's for educational purposes only. It is absolutely not medical advice.
Right.
We strongly, strongly encourage you to consult with a qualified healthcare professional before you start any new supplement, ashwagandha included. They can help you figure out if it's actually right for you and safe given your individual circumstances.
Okay, so wrapping up, the research we've explored today suggests ashwagandha has potential in a lot of areas. Reducing stress and anxiety, maybe improving sleep, enhancing athletic performance.
Right, potentially supporting some aspects of mental health, male hormone balance, blood sugar regulation, inflammation, brain function. It's quite a list.
It is.
But it's so vital to emphasize again, talk to your healthcare provider before using it. You really need that professional guidance to weigh the potential side effects, the precautions, those interactions with meds, and figure out a safe dose for you.
It really is fascinating to see modern science digging into the potential of this, ancient botanical.
Mm.
As you, our listener, think about all this. Consider how these research benefits might connect with your own well-being.
Mm-hmm.
But always prioritize making informed choices and make them in consultation with your healthcare provider.
Absolutely. Keep exploring if you're interested, and definitely discuss any questions with your doctor.
Thanks for taking this deep dive with us today.